Modern medical diagnosis has entered the high-tech age. With the introduction of the CT scanner and MRI, cancer tissue of only a few millimeters in diameter can be detected in its early stages. However, these high-tech medical tests are not only expensive, escalating the cost of medical care, they are sometimes harmful or painful to the patient. But there is a new, more simple, non-invasive, safe, reliable and very economical method of diagnosis available. It's called the bi-digital O-ring test and can provide much useful diagnostic information.
Well, I cough a lot.
You cough, Hey.
My chest gets tight. And I hear a high-pitched sound in the back of my head.
Please move back about 20 centimeters. First, I'll check your bronchial tube. There's nothing wrong there. Now the right lung. You have very strong abnormality here. Now the left lung. You have no problem with your left lung. This is the bi-digital O-ring test, which allows abnormalities in the body to be found by seeing if the ring made with 2 fingers can be pulled open or not, and by noticing the degree of opening. Since the discovery in 1977 of the bi-digital O-ring test by Professor Omura, much research has been done and considerable information behind the mechanism of the test is now known. If this method becomes established, not only can the diagnosis of difficult medical problems be made, but also optimal treatment including effective medication and dosage can be determined. In Japan, many physicians and dentists are already being trained in this method. In 1990, the Japan Bi-Digital O-Ring Test Medical Society was established. This group holds annual symposiums at Tokyo University. In addition, they hold an international symposium every 2 years.
Hello, I'm Yusuke Kawazu.
Hello, I'm Tamako Nakano.
When we talk about medical diagnosis to examine inside the body, we tend to imagine CT and PET scans, MRI, ultrasonic diagnosis, and other complex examination methods. But if a diagnosis could be made with just 2 fingers, it would be quite revolutionary.
The O-ring is simply made with just 2 fingers. I have doubted it myself. Can they really make a diagnosis like that? According to clinical examples, there are a considerable number of reports that show significant results.
Television Museum has been researching this phenomenon called the bi-digital O-ring test recently. Also, I learned that many doctors are seriously trying to learn, understand and practice this method, incorporating it with Western and Asian medicine. For 2 weeks, we are going to investigate the bi-digital O-ring test.
By seeing if the O-ring made by 2 fingers opens or not, any abnormality in the internal organs can be detected without the use of high-tech machinery. This method was developed by Professor Yoshiaki Omura, a Japanese-American physician trained at Columbia University Medical Center and Director of Medical Research at the Heart Disease Research Foundation in New York City. It has begun to receive attention in many parts of the world. In Finland, the Ukraine, Yugoslavia and Venezuela, the bi-digital O-ring test has been incorporated into the medical school curriculum. In Japan, more than 10,000 physicians, dentists and acupuncturists participated in Professor Omura's seminars. And as a result, many doctors in different hospitals have begun to compare the results of the O-ring test with standard laboratory tests. St. Mary's Hospital of Kurume City, the second largest and model hospital in Japan, is one of many research sites to compare the O-ring test with lab tests.
This is Dr. Shimotsura, Director of Medicine at St. Mary's Hospital, who was conducting the examination earlier. Thank you for your time. Could you please show us how to do the O-ring test?
Please turn and face me. Please make a ring. Let's start with the right hand. It's best to make the ring as round as possible. The examiner also makes 2 similar rings and pulls at the ring that you have made. Let's try it.
Is it better not to open?
Yes. This is before we begin testing. So, we use this to select the test finger. Next, the thumb and the third finger. This also won't open. The thumb and the fourth finger. This opens easily. The thumb and the little finger. This also opens easily. If we use the fingers that were easily opened in the examination, no matter where we examine, the result will always be the same. So, we use the test fingers that can resist the examiner's pull.
So you choose the person's stronger fingers over the weaker ones.
That's right.
How do you use this to diagnose an illness?
Well, as we just showed, we choose which fingers to use by trying to pull them open. Then, we confirm that they won't open by touching a normal part of your body.
For example, the head.
Yes, we will examine the head.
Is that bamboo?
Yes, it is. We use a non-conducting rod in this direct method. They won't open.
So there's nothing wrong with my head.
Yes, that's right. Now the bronchial tube.
They won't open?
No, they won't open.
So there's nothing wrong there either.
That's right. Now let's try the heart.
I wonder what that's like.
What?
They open.
They opened, didn't they? So there is something wrong with my heart.
That's a possibility.
There is quite a difference between when they open and when they don't.
There is a difference, even though I'm applying the same pressure all the time.
Yes, there is.
Even though he's wearing clothes, the results are still very clear.
Therefore, in the control, we choose the fingers to use or the results will differ. In actual clinical examinations, often a third person makes the O-ring, not the patient themselves. So does this give the same results?
Earlier, you were using the assistant's O-ring to make the diagnoses. How does this work?
In a one-on-one situation with a patient, we conduct the examination using a non-conducting rod touching various parts of the body. However, we can also use a third person. This is known as the indirect method. Let's try it now.
Okay.
Please sit down.
So you'll examine the same places you did before?
That's right. The abnormal electrical signals from the patient will be transmitted through the conductor to the third person's body. Using the third person's central nervous system, we can make an analysis. First,
The head of the patient.
So that means the head is all right.
right, the bronchial tubes. There's nothing abnormal there.
The same results.
That's right, the same results.
You get the same results, even if you use a third person. So, do you also use a non-conducting rod if you use a third person?
No, we use an electroconductive rod. Either a brass or copper rod is used during the examination.